Welcome to Issues and Answers with Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. We can still say Happy New Year, Happy 2026 to you and your families from everybody at KCHF TV and from Issues and Answers. Oh, legislative session is here. It's here every year. This year it's a 30-day session. So they say, 30 days, how much? Perhaps half the damage that can be done in a 60-day session. Well, my guest today, who is the founder and executive director and board member for Think New Mexico, always looks forward to the legislative session because they could do some good and help us. One of the agenda items for Think New Mexico this year is enacting medical malpractice reform. We're going to talk to Fred Nathan about what is this. We talked to him actually last year in our program because they think New Mexico made that a priority. A bill was passed, I believe. You're going to tell us what happened with that bill. I think it passed, maybe it didn't, but we're going to find out what Think New Mexico is doing with their legislative agenda regarding medical malpractice reform and why that's important to you and me. We'll be back with Fred Nathan right after this. Okay, bad me. The bill to reform malpractice did not pass. Fred Nathan, executive director, founder, 27 years with Think New Mexico, and a priority for Think New Mexico, this nonpartisan think tank that goes to the legislature and says, you know what, we've examined these topics, they're going to improve our state. Please pass legislation and help us. You've chose this year, Think New Mexico, as well as last year, medical malpractice reform.
Yeah, I think this is an issue that's getting some traction. It's the number one reason that doctors tell us that they leave the state or retire early. And last year we introduced a bill on the 8th day. Didn't get a hearing.
8th day of a 60-day session. That's
correct.
Pretty, okay. That's
pretty early.
Pretty early.
But we didn't get a hearing till the 53rd day. So 45 days passed without getting a hearing. But that's the bad news. The good news is during that 45-day period, we were talking to a lot of legislators, and we got 12 Democrats and 12 Republicans who said, I want to co-sponsor that bill. So that was the most co-sponsors for any bill in the last session. So it shows that this is an issue that's gaining traction, especially among some rank-and-file legislators, and gives us some optimism for this upcoming session that we'll be able to pass a bill next year.
Well, this current year.
This current year, yes.
2026, we need to pass
yes.
this. 12 sponsors, Republican, 12 Democrats. Congratulations on that. I think perhaps they heard from their constituents on this issue, or they couldn't go see their own doctor, maybe one of the two.
I think you're exactly right. I think the public is saying, and I see it, when I give speeches around the state, many people can't find a doctor in New Mexico, or if they have a doctor, can't get in to see them when they need to. That's why our board, as I mentioned in our last program, chose this topic because they started talking about it, and everybody had a story to tell about not being able to get a doctor or a physical therapist or a dentist. So it's something we're trying to address in a comprehensive way.
And these medical providers, not just doctors, but therapists, dentists, psychologists, psychiatrists, physical therapists, occupational therapists, they are being sued. And so because of that, because of our medical malpractice, allows big jury findings for the plaintiff. They're saying, the professionals are saying, I'm not taking any part of this anymore. I'm going to hightail it out of New Mexico.
So when we did the report, which came out in September of 2024, we had the second highest number of malpractice cases per capita.
The second highest
number of malpractice cases per capita. Now we're number one for the last year.
Come on. And that's pain. I mean, that's pain, damages and pain.
So that's just the number of cases.
Oh, number of cases.
Now on damages, we looked over the last dozen years where New Mexico's consistently above the national averages for paid claims, $500,000 or more, and way above our neighboring states. we actually have a chart, I think it's on our website, with these 3 lines. And for every year for the last 12 years, New Mexico is above the national average, sometimes way above it. And below the national average are our neighboring states. And so when you have a lot of cases for high damages, you can expect that there's going to be high medical malpractice premiums. And we found this statistic from the Department of Insurance here in New Mexico, which it's called the insurance loss ratio. It sounds boring, but what it's measuring is very interesting, which is for every dollar that medical malpractice insurance companies charge in premiums, for every dollar they collect, what do they pay out in claims? The answer is $2.23. It's the highest in the country. It's 3 times the national average. And then when you drill down on OBGYNs, for example, or some of these other specialties, like OBGYNs, they're paying multiples in insurance relative to OBGYNs in Colorado, in even California. So this is the number one reason why New Mexico, we think, has this shortage. And there's a study out that we cited showing that New Mexico was the only state to lose doctors between 2019 and 2024. So then we looked at, well, what was going on nationally during this period? Well, the number of doctors going up nationally was going up 44,000.
They were graduating from medical school.
Right, and we were losing doctors. We lost 248 doctors, which is about 8% of our active physician workforce. And for that, we looked at doctors who were billing, which is the best way to measure it. We didn't want to look at how many doctors we have, because some of those have licenses, but they're retired or they're not practicing. So we're the only state in the last 5 years to have lost doctors when the demand is going up, right? Because the state is aging, the population is aging. So the demand for services is going up, the number of doctors is going down. So this is really a full-blown crisis that needs to get addressed right now. I don't want to make you more depressed, but we're also number 1 in the age of our physicians. So it's expected that about 39% of our physicians currently will retire between now and 2030. So that's why I say this is an urgent problem that can't be kicked down the road anymore. It needs to get addressed in this upcoming session.
It needs to get addressed in 2026. Disheartening to hear that last year we are number 2 in the number per capita of malpractice lawsuits.
Right.
Now we've grown. I mean, what are they saying? Oh, this is pretty lucrative to sue. I mean, we're number 2 per capita. Now we've gone, and this is one of those lists where at the top, that's a bad list. We're number 1 in the number of suits against medical professionals.
And, we also have a problem in the sense that trial lawyers from Texas and other states are now coming into the state because we've created such an unbalanced system that's so favorable to trial attorneys. So, for example, we have the lowest standard to prove punitive damages by a preponderance of the evidence, and we also have no cap on punitive damages and no cap on attorney's fees. So it makes it very attractive to bring these lawsuits. And I think ultimately, Diane, that's why we're number 1 in the number of lawsuits, because we've created this sort of legal paradise, if you will, for bringing these kinds of lawsuits.
I hadn't heard that, Fred Nathan, that attorneys from other states are coming in here because it's a little gold mine they found. I didn't hear that.
Well, last year, you probably heard of the New Male Medical case. This was an erectile dysfunction case gone wrong. The case resulted in $37 million of compensatory damages and then $375 million in punitive damages. The total, 412, the lawyer from Iowa who brought the case in Albuquerque, according to his press release, which we have, said this is the biggest state judgment of punitive damages in the history of the country. So that's what happens when you put all of these pieces together, is it makes it very attractive for trial attorneys and very unattractive for doctors in terms of trying to recruit them and trying to retain them and keep the doctors that we have.
You'd mentioned the, well, my head's spinning. Our head's spinning about that. We can't afford to get a headache, though, about it because there's no doctor to see. Regarding, you said about insurance, the insurance was what, paying out $1 for, I mean, the physician paid $1 in insurance, but the insurance companies paid out $2.50, $3. How can they afford? How can the insurance companies stay and afford that?
That's a great question, and we had the same question when we looked at that data. So we visited with Alice Kane, who's the superintendent of insurance for New Mexico, and we said, you know, how can this be sustainable? And she said, you know, it's what keeps me up at night too. And so I said, well, how many insurance companies write insurance in New Mexico for medical malpractice? She said it's about 10, but that's misleading because it's primarily 3 that write it. One of those companies is the Doctors Company, which is actually a nonprofit. And what they're doing is they're cost shifting, taking premiums from doctors in other states so that they can pay the claims out in New Mexico. So
they're taking premiums from other states because they're not paying out these large suits and using that money here.
Right. And they're committed, they say, to covering all doctors in the country, if you look at their website and so forth. But I wonder if they're going to be able to continue that if we continue to have so many cases and so many large judgments. The other thing to understand about, you know, punitive damages is that's not covered by insurance. That's covered by the provider. So oftentimes doctors tell us they get hit with a lawsuit, they think it's frivolous, they want to fight it, but they don't want to roll the dice with a jury because if they get hit with punitive damages, their insurance company won't cover it. So they pressure the insurance company to just settle the claim so that they have no personal liability. So what we're trying to do in this bill, in coming up in this session, is to raise the standard of punitive damages. As I said earlier, we have the lowest in the country. Preponderance of the evidence is, you know, if a judge or a jury is about 51% sure, then they can award punitive damages. Punitive damages in most places is only awarded in the most extreme cases. So 32 states, about 2/3 of all states, use a much higher standard, which is clear and convincing. You have to have clear and convincing evidence. Colorado, our neighbor to the north, uses the criminal law standard. In other words, it has to be beyond a reasonable doubt. So you have to be 99%. Clear and convincing, more like 95%. 6 states just ban it altogether. And
ban punitive.
Ban punitive damages, blue states and red states. The other thing is capping punitive damages and protecting providers from their personal assets. And I did talk to a trial lawyer who said, oh, we never go after doctors' personal assets. And I said, well, if that's the case, then why don't you support our efforts to put that in statute? And it won't change anything, it sounds like, but let's give them that peace of mind, that protection, and maybe that'll help to keep more of them here and help us to attract more doctors here.
And are they going to do that?
We'll see. We're going to give it our best shot.
How can physicians, medical professionals afford the insurance?
Well, many can't. So Andy Metzger is an example of a doctor born and raised in Albuquerque, neurosurgeon. He was practicing in Albuquerque, and even though he didn't have a medical malpractice case against him, his premiums were going up so much that he moved to Phoenix. He testified under oath on our bill last year to the Senate Health Committee that his premium in Phoenix is 1/5 of what it used to be in Albuquerque. And so that's a clear example of someone who has left the state because of their medical malpractice premiums. I can give you another example. Debbie Vihel is an OBGYN in Santa Fe who retired early after the laws got changed in 2021. Again, no successful medical malpractice claims against her, but her premiums rose to such a level that she wrote an op-ed in the Albuquerque Journal saying, you know, I adore my patients, I love my patients, I wanted to continue to practice, but I didn't think I should have to pay money to practice. Full disclosure, she was my wife's OBGYN and my daughter's, and just sort of an iconic figure in Santa Fe, but I can't blame her.
No, and no longer.
And she's not
no
practicing.
longer practicing.
No longer. So there you have two examples of specialists where they've either left the state or retired early just because of their medical malpractice premiums. And the thing is, this is fixable. You know, usually, like when we're working on issues like public education, there's about 1,000 levers out there, and you never know which ones to pull on and how hard to pull on them. What's interesting about this, from my standpoint as a policy wonk, is we know what the solutions are. We know that we're an outlier on punitive damages, both the standard and the caps. We know we're an outlier on venue shopping, which we can talk about, and some of these other issues like stacking. We're also a state that doesn't cap attorney's fees. When we look at other states that are progressive states, they all cap attorney's fees. California, New York, Massachusetts, Illinois. And they do that because they realize that those fees are sort of a zero-sum game. The more that goes to the attorney, the less that goes to the patient who's been harmed by medical malpractice. That's the whole point of a medical malpractice law.
Is to make them whole.
Exactly. And we're not doing that.
Because the attorneys are getting the hole.
Right.
Get the big hole. And it sounds to me like it encourages the frivolous lawsuits. I mean, everybody hates the frivolous lawsuits. Cost all of us. But if they don't have to have any preponderance of evidence,
it's easier to prove these cases.
Easier rolling the dice for the attorney and for the person bringing the lawsuit.
But I'm optimistic. I've been talking to a lot of legislators, and I think the tide is turning just from last year, where we're seeing, you know, I mentioned we had 12 Democrats, 12 Republicans, but more and more rank and file legislators are approaching us and say, I'll do anything to help you. So I'm optimistic that we can get something accomplished in this session.
How does this bill change from last year?
Changes a lot.
Oh, does it? It does?
Yeah.
But you like last year's bill.
I loved last year's bill. Last year's bill highlighted some of the problems where attorneys are putting their interest ahead of their clients. So, for example, we wanted to cap attorneys' fees, and they came in and opposed that. This year, we thought we would just do a comprehensive bill. So it's basically the whole menu. And it's really just sort of an opening offer to the trial lawyers, who are the only ones that oppose this, to say, let's create a menu of items that really need to be addressed, starting with punitive damages, including attorney's fees, but also things like venue shopping. 31 states prohibit venue shopping, and you and your viewers are probably rolling your eyeballs.
Oh, I know some of these, Santa Fe gives bigger awards than Lee County.
That's exactly right.
So if I'm going to bring a lawsuit, I would go to Santa Fe because I want them to be more accepting and pay out the bigger awards. And
that's exactly what's going on. 31 states prohibit that. And I think the reason they do that is a belief that providers should be held to community standards in the community in which they practice. It's really about fairness. And why should the witnesses and the providers travel all the way across the state? It just seems more reasonable. But
criminal cases have to be, I thought, in the district or the city where the crime was committed, correct?
Not correct. They can actually, if there's local prejudice, they can be moved.
Local prejudice, but they have to go to the judge.
They can be moved out of state, and that makes sense. But here, it's just being done because they can get, as you point out, higher judgments, particularly in the first judicial district, Santa Fe and Espanola, and in Las Vegas. That's where these cases get moved.
But with the criminal, they have to ask for a change of venue. Right. But otherwise, it's usually in where the crime was committed.
Here, they can move the case if there was a death, if there was incapacitation, or if it involved a minor. So then they get a personal representative who's a lawyer in, say, Santa Fe or Espanola or Las Vegas, and that alone is enough to move the jurisdiction, even if all the witnesses
are in Lee County.
In Lee County.
God, okay.
So so that's another thing that needs to get fixed.
We're wishing you the best of luck in all of this because it
you.
affects all of us.
Should we also talk about the compacts?
Yes, interstate healthcare worker compacts. Now that sounds really basic and easy. It sounds easy. I mean, it sounds easy.
You're right. It should be a no-brainer. And just for your viewers who may not be familiar, this started with the Department of Defense about a quarter of a century ago. They noticed that when when their state service people moved from state to state and base to base, they often had a trailing spouse who was in the healthcare sector. And when that spouse came to the new state, they'd have to get relicensed and recredentialed. And that often took at least 3 months, sometimes half a year, and they lost out on that second income. So they said, this should be more like the driver's license compact. And that's what allows us, you get a license here in New Mexico, and you have the privilege to drive in any of the other 49 states. And they said it should be the same thing. And so they adopted a whole bunch, or created a bunch of interstate healthcare worker compacts, not just for doctors, but nurses, physician assistants, psychologists.
So if I'm
EMTs.
licensed in Minnesota and I choose to come to New Mexico because of our great weather,
you can be licensed immediately if we're in the compact. The way you join the compact is your legislature just has to say, we're in. We want to be in.
Well, and the licenses should be probably comparable. They probably examine to see if there is.
Oh yes, they check if there's been any disciplinary action. So just.
But also if their requirements are, I mentioned, similar. You need 4 years of education or whatever. You need an internship, right, to be licensed in another state. I imagine they're very similar license requirements here.
Yes.
But we're not part of the compact. Why would we not be?
So fast forward 25 years, and most states are in most of these 10 major compacts. New Mexico's in just one, the Nurses Compact, which by all accounts has been an enormous success and kept some of our rural hospitals open. Colorado's in all 10. Arizona is in 7. Utah's in 9. Oklahoma's in 8. Even Texas is in 5.
Okay, why aren't we in any?
The reason is because every one of the compacts has a provision that says we're governed by a board of commissioners, and those commissioners are immune from lawsuit for their official acts. Now, to the trial lawyers, they don't like that because they say it creates a precedent for the legislature to immunize other groups of people, but there is no effort to immunize other people from lawsuits. And you would never sue if there was a malpractice in, say, Albuquerque. You're not going to sue the commissioner in, for example, Rhode Island. You'd never recover. But to them, it's just the principle of creating this precedent.
To have people exempt from a lawsuit, and the trial lawyers don't want people exempt from any lawsuits.
Bad for business.
Wow, bad for business.
So, but then if you look at it from the standpoint of patients, and the best example of this is the Casals family. Michael and Naomi are husband and wife. They have 2 kids. The youngest, Sebastian, was diagnosed at 2 with a very rare and aggressive form of cancer. They took him to UNM Hospital. The hospital there said, we've never seen this kind of cancer before. If it's our decision to make alone, we would amputate your child's hand, but we want to strongly encourage you to get a second opinion. So Naomi and Michael called all over the country and found people, doctors in Pennsylvania and Michigan, who had some familiarity with this. And those doctors said, bring Sebastian here immediately so we can examine him in person. And they had to point out, well, our doctors here, this was during COVID, don't want Sebastian going through an airport, but what if we just do this on our cell phones, on FaceTime? And in both cases, the doctor said, but New Mexico's not in the compact. And if we gave you a medical opinion...
They couldn't practice here. They could not practice here.
Right, we'd be practicing without a license, which is a 4th-degree felony. So...
Oh my gosh.
So then Michael and Naomi, what they essentially have to do is take their child to Texas just to have a phone conversation with their doctor because
we're... compact. Okay.
So that's what's
2
happening.
2 minutes to go, Fred.
Yeah.
So why, other than the trial lawyers say, no, we can't sue because of these board of directors on this, what are we going to do about this compacts? We want to be part of the compacts.
Well, we need to be in all 10. And we're just in the Nurses Compact. Legislative leadership is saying, we'll join the Doctor Compact, and we'll join the social worker compact. But it's important for people to understand we have shortages of every category. EMTs might be our biggest shortage, for example.
Boy.
So we need to join all 10 of the compacts. And like the Doctors Compact is 42 states. So it's important to understand that a compact is like a contract between states. And we're also hearing that some legislators want to amend these compacts. Well, if they amend the compact, then those 42 states, they have to take the compact back to those 42 states, and those legislatures have to make the same amendment that we made in New Mexico. So we're hopeful that we can just get beyond that and just join these compacts. By the way, you can leave a compact at any reason, at any time for any reason. No state in the last 25 years has ever left. So we need to join all the compacts in this upcoming session. And that's the single most important thing, Diane, that we can do to address these shortages in the near term. In the longer term, we need to do something to bring our medical malpractice laws into some type of balance so that it's protecting the patients who have been harmed, but at the same time not driving away our doctors into early retirement or leaving the state.
Think New Mexico is doing a lot on behalf of all of us. What do our viewers need to do on behalf of Think New Mexico to pass these things?
I'd encourage them to go to our website, and on our website, on the homepage, you can see Take Action, and just click on there, and there's a pre-scripted letter. You don't even need to know, Diane, who your legislators are. Just by typing in your address, the computer knows where to send it. And we encourage you to actually delete the pre-scripted letter that we wrote and write about your own lived experience, about your difficulty finding a doctor or getting access to care or trying to get telehealth, but being stymied by the fact that we haven't joined these compacts. Thank you for having me back.
Our action sounds more simple, but doable.
But extremely helpful. It really makes a difference.
Fred Nathan, the founder, executive director, and board member of Think New Mexico, thank you so much for all you're doing on behalf of all of us for the state.
Thank you for having me back.
And thank you for watching. I'm Diane Kinderwater. Happy New Year. We'll see you next time. Bye-bye.
Issues and Answers with your host, Diane Kinderwater, is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program, email us at info@kchftv.org or call us at 505-345-1991. Join us again for Issues and Answers with Diane Kinderwater.